Okay, good morning. I'll do a test now. Test, test, test. Let me take a look. Okay, testing, testing. Okay, I think it's all looks good, all looks set, and we will be ready to start. Good morning. Today is Saturday, March the 18th, 2023. This is our regular scheduled yoga therapy class. As you know, before pandemic, we used to do in person. Now we are doing virtual. Today I'm in a different setup. I'm in my daughter's house, babysitting our granddaughter. She's a year and a half, and she also been doing yoga with me, so she might come and show up during our session. So we present our experience based on what we have been teaching in our community. Today's topic will be yoga therapy to restore health. And if you restore health, it becomes a treatment for metabolic syndrome, which is called the treatment of the disease and then called maintenance of health. In Sanskrit, called roger chikitsa, treatment of the disease, and shasturokha, maintenance of health. As you all know by now, that metabolic syndrome is the disease which is killing us. It starts with, first it is the outcome of our stress affecting our emotional brain called limbic system, and through a cascade of phenomena, we call it a psychoneuroendocrinology, producing cortisol, which in turn produces this, our truncal obesity, expanding waistline. This is the fat inside our abdomen called omentum, which secretes a pro-inflammatory molecule, and inflammation causes diabetes, hypertension, atherosclerosis, or coronary artery disease, which we call blockage of the coronary arteries, dyslipidemia, high cholesterol, or high triglyceride and low HDL. HDL is a good cholesterol, high density like protein. These are not separate disease anymore. These are not the risk factors. This is a one disease entity which is from a stress. Health in yoga is defined as a strong digestion, easy elimination, and good night's sleep. Where did they learn it from? They learn it from the babies. A good baby will eat, poop, and sleep. If they don't do it, there is something wrong with their health. Same as us. So yoga gave us asanas, pranayamas, meditation to restore health. So today we'll talk about the asanas. The first, for strong digestion. Strong digestion is called igniting your digestive fire, called Jathar Agni. There are 5 asanas. It is all laying down. First one is a fit raising called Utthita Padasana. Next one is a boat pose called Naukasana. Third one is your knee chest, Pavan Mukta Asana. And hey, come on in. Look, we got a visitor here. This is a yogini. So what's your name?
Anu.
Anu?
Anu.
Anu?
Say Anu.
So my name is Anu.
Mama.
Mama. Can you show yoga pose? Can you show yoga pose there? Can you stand up?
Can you show?
Can you show yoga pose? One feet high up. Let's do one feet high. Yeah. I'm doing yoga
Can you
pose.
do the tree pose, Mama?
Can you do a tree pose? Do a tree pose. 1 feet higher. Yeah. Okay. Can you sit down with your cross-legged? Sit down with the cross-legged.
Mama, can you do this one?
Oh, go down dog. Yeah,
Down
here.
dog. Can you
Do a
do
down dog. Okay. Do this way. Do a down dog. Head down. Down
Oh,
dog.
cat pose, cat pose.
Cat pose. How about a down dog?
Down
Put
dog?
your head down. Huh? Do a down dog. Put your head down. Ooh, feet up. Okay.
Okay, Mama.
You want to do a headstand? Put your head down. Headstand.
No, no.
Yeah. Let's put your head down. Put your head down. Let's go. Go head down and go high up. Yeah.
Good
Try
job.
to do a headstand. Ooh.
Okay, Mama, come on. Let's go.
Okay.
Say bye-bye. Say bye-bye.
Say bye-bye to them.
Bye-bye, Bola.
They're watching you.
Bye-bye.
Say bye-bye. See,
Bye-bye.
see you later. Oh, you're supposed to do more?
No.
You want to do
Bye-bye.
more? Okay.
Bye-bye.
See you later. Later.
Later.
Thank you.
Okay, come on, Mama.
Okay. Just trying to tell you again that all the babies do yoga. They'll get up into a cobra pose, they'll get into downward facing dog. They love 2 things, which you have noticed. They love your head down, downward facing dog, headstand, and they do a back bend. These are the 2, they're loving it. Actually, one of my friends who's a radiologist, who is also a yoga practitioner, he was looking at the baby inside the mother's uterus, and he said, all the poses the babies were doing is a yoga pose, and essentially said, when the baby comes out, it comes out with the headstand. The head comes out first. Okay, interesting. She wanted to come and join me because she does yoga with me. Okay, coming back. For your strong digestion, gave us called fit raising, called Utthita Padasana, boat pose, Pavan Mukta Asana, knee chest. Then is your bridge pose, Setubandh Sarvanga Asana. Then your feet touching your forehead, Pada Mashtika Asana, feet touching your forehead. And finally, the few pranayamas. Most important pranayamas here. Remember, this fat here, this is from your stress. So the treatment of this is a relaxation response and activation of parasympathetic tone. What it does, The Kapalbhati Pranayama, the breath of fire, and your abdominal lock, Udyani Bandh, and the movement of the abdominal wall called Agnisar Kriya. They're massaging all the fat inside, and they also is a relaxation response and activation of parasympathetic tone. It's a wonderful, wonderful practice. For easy elimination, it is called your Shankha Prakshalan. Shankha means a metaphor of intestine, Prakshalan means cleaning. There are 5 asanas. You're sitting down. It's called your Udar Karshanasana, Udar Karshan, massaging your abdomen, or it is called basically your extension of your squatting pose called Malasana. Then you have a cobra pose, which is called a oblique cobra, Tirjak Bhujangasana. And then you'll be standing up. We do a called upward mountain pose, the Utthito Tadasana. Then going on the side called oblique mountain pose, and then turning your west called Kati Chakrasana. And for the good night's sleep, we have a whole set of how to sleep like a baby, how to sleep like a yogi, and we'll go ahead and finish it. So let's start first with let me get into here. Or maybe I can just get a little bit down here. When you are not in your place, you have to make all these adjustments. Let me go a little bit further. Okay, you'll be able to see what I'm laying down. The first is your digestion. This is the practice we do every single day. The practice we do for maintaining our health. Strong digestion tells you that the food is converted into 7 tissues, and then at the end it forms a substance called ojas, and ojas is our immunity. Sign of proper digestion is lightness in your body and mind, proper hunger and appetite, and most important finding of a proper digestion of a food is no smell in your excreta. When urine doesn't smell, stool doesn't smell, perspiration doesn't smell, that means food is being properly assimilated. If the food is not properly digested, it forms a toxic substance called AMA, A-M-A, AMA, which in our Western medical term is nothing but high blood sugar, high cholesterol, high uric acid. Anything high in the blood is nothing but undigested food material. So the laying down in the mat or even laying down laying down in your bed, be sure your head, your chin is not too high up. If your chin is like that, if it is like that, then put a little pillow and try to put the chin a little bit down. Hands on both the sides, palm facing high up. If you're properly relaxed, your whole hand will fall in the ground. It will touch your little finger and thumb, both sides. About 6 inches from your body, and your feet is about just the width of your mat. Breathe out first. Slowly take a deep breath in and breathe out longer than breathing in. A few more times. Breathe in. Breathe out. So, all the asanas to improve your digestive fire is at the center of your belly button. In yogic term, it also called centering your belly button. There is a way you measure that your belly button is not centered. When the belly button is not centered, you feel that the digestive fire is not strong. You also can do one thing. You can put your head down slowly into belly button, and you'll be able to feel a pulsation called aortic pulsation. Aorta exactly in the midline, called abdominal aorta, is a blood vessel, and you'll be able to feel the pulsation. It's all the way to the back. Put your feet together. First asana to improve your digestive fire is to raising your feet high up. Not all the way high up, just about 30 to 45 degrees. Stay here, Pada Uttanasana. Then slowly get your body high up and get into your boat pose, Naukasana. So when you get a Naukasana, you can feel that you are having fasciculation. Sthiram, Sukham, Asana. First asana, feet raising. If you're practicing with me, you can do it with me. Very simple asana. Feet raising, then get into a boat pose, Naukasana. Third asana, your knee chest, Pavan Mukta asana. Hold your knees, slowly bring it up, close to your chin is in front of your. I'm just showing you the asanas, but during practice, you need to do them between 5 to 10 breaths, and also do it effortlessly, then no pain, with a effortless breathing. Fourth asana, bridge pose, Setubandha Sarvanga Asana. Separate your feet until the width of your shoulder. Touch the back of your heel and slowly raise the body high up. Put your hands together and whole body goes up. It's like a bridge pose. Once the bridge is very stabilized, you can balance it with 1 foot high up in a bridge pose and get the another foot high up in a bridge pose. Slowly get down, 1 step at a time. Fifth asana. Fifth asana is your Pada Mushtika asana. Feet touching your forehead. Hold onto your 1 foot, bring it up and slowly touch it to your forehead. Hold the other foot. Now it's the left foot, bring it up, touch it to your foot. Pada Mushtika asana. So going a little further, you can hold both the feet, bringing it up and touch it to your foot. Again, going over these asanas being described in our traditional yoga practice, and the practice is called centering the umbilicus. You can take a thread from the belly button and measure from here the right great toe. And take the same thread, connect from belly button to the left great toe. Both will be equal. For men, you can do belly button to the right nipple and also the left nipple. Both should be equal. For women, you can do from belly button to the medial end of the clavicle on the right side and medial end of the clavicle on the left side. Strong digestion. Fit raising pose, boat pose, knee chest pose. The Sanskrit name tells you everything. Padavuttanasana, fit raising. Naukasana, you are like a boat. But in the asana, if you stay in the asana for some time, you feel like you are merged into that asana. You feel like you are a boat. knee chest, Pavanmuktasana, releasing your gases from the vata. Setuban Sarvangasana, the bridge pose, Padavastikasana, feet touching your head. Slowly get up, turn onto your left side, and stay here. Put your head in the folded hand and straighten up your right foot and get up slowly in a sitting posture. This was strong digestion. Easy elimination. Easy elimination is through another yogic practice called Shankha Prakshalan. Shankha Prakshalan generally is done as an internal cleansing. There are kriyas. There are 5 kriyas which is called for Sharir Shuddhi. That means purify your body. Tratak, looking at a one point, maybe a flame, one pointed finger, and not able to blink at all. Tratak. Sharir Shuddhi. Nasya, cleansing your nose. Like your jalneti, you can do with the oil. Cleansing your nose, keep the nose completely free of any mucus, any blockage. So the breathing has to be through your nose, not through your mouth. Tratak, Nasya, Kapalbhati, rapid Kapalbhati, Kapalbhati is called your dhoti. Dhoti is your cleansing your stomach. You do a Vamandhoti. Vamandhoti is keep on drinking 2 glasses of water until you feel a little full. When you're full, you stand up, you touch your soft palate. It's a relaxation response. The whole water comes out. It's called a Kunjal Kriya. It's like a water coming out like an elephant. A rapid Kapalbhati Pranayam is a Kriya, and a slow Kapalbhati Pranayam is a Pranayam. Once the Nauli, you do a abdominal lock like a Uddiyani Bandh, isolate your rectus muscle in the middle and move the rectus muscle side to side to massage the internal organs. In a Shankha Prakshalan or internal cleansing, these are cleansing to Sharir Shuddhi. That means your physical body. In a Shankha Prakshalan, you do 5 asanas for proper elimination. So you drink, keep on drinking 2 glasses of water, and you go for you do the 5 asanas and have a bowel movement. If you don't have any bowel movement, drink more water. Do the 5 asanas. And keep doing it. Eventually, within a short time, half an hour, 45 minutes, you'll start have a bowel movement, In fact, slowly you will see that literally a clean water comes out. That means whole intestine gets clean from mouth to your anal canal. This is called a Purna Shankha Prakshalan, and it is done probably in 6 months or once a year. And there is a lot of procedure after that which you need to follow. One of my friend who is a gastroenterologist, he was using these 5 asanas for preparation of colonoscopy. And he has shown when you do the preparation with these 5 asanas and water intake, your colon is very well clean. So the first one for proper elimination, as you know what you do in the daily morning, you get up in the morning, we sit down in a squatting pose. This is called your malasana. Mala means excreta. These will have a proper excretion of your stool. The reason is it relaxes your pelvic muscles. It also straightens up. It also straightens up your anorectal junction. That means normally there is a little bend or kink between the anal canal and the rectum, so you don't have any incontinence. But with this posture, your bowel movement is nice. But you cannot do this with a bowel movement in our regular commode. So what we have is called a squatty potty. You put a squatty potty, it comes in a 2 different height. One comes in a 6-inch, one comes in a 9-inch. You can sit down in a squatty potty and it will have exactly the same effect of sitting in your squatting pose. You create a relaxation. When hands are relaxed, your fingers will be all separated. This is their hand, their fingers will go in and out. Wrist gets relaxed. Then you put your one elbow inside, other elbow inside. You bring your hands high up and you sit down in a squatting pose. Next, you extend it for your Shankha Prakshalan. We call it Udar Karshan Asana. So take your left knee, put your left knee in front of your right foot. And remember, be comfortable. Right knee pushes towards your left side. Left hand is on your left knee. Turn your body towards the back and stay here. Udar Karshan Asana. So one side, then you take your right knee, put it in front of your left foot. The right knee goes towards your left side. Turn your body. Deep breath in, all the way to the back. And you will be able to feel that there is no pain and you have a effortless breathing. Udar Karshan Asana. Udar is your stomach, Karshan is your massaging. Stomach massaging asana. The number 1, asana for proper elimination. Remember, these are the signs of health. Wake up in the morning. Drink a 2 glass of water called Ushapan. Sit down in a malasana, squatting pose, and you'll have a proper elimination. That's a sign of health. When you drink the water, you drink the water in a gulp. It starts the peristaltic process. When you drink a water, there's a stretching in the stomach. Stretching in the stomach will cause the contraction of your colon, which is called your gastrocolic reflex. Has a proper elimination. On the other hand, if you have a full meal, like you have a lunch or a dinner, and after a meal you have a bowel movement immediately following a meal, that is a sign of your irritable bowel syndrome. So remember, it's a gross distinction. Drinking water in the morning, having a bowel movement is a sign of health, and have a bowel movement after a main meal is a sign of disease called irritable bowel syndrome. Next asana for proper elimination is called your Tirjak Bhujanga asana. Bhujanga asana is a cobra pose, and Tirjak means your oblique cobra pose. So you lay down on your mat for your cobra pose. When you lay down, you first relax yourself. Relaxation is done one hand on the top, another hand in the top. These are also called name of very powerful asanas. All the relaxation asanas are most powerful. This is called your Shakti asana. That means it gives you the strength. Turn your head on the right side, looking at your right elbow. Eyes are closed. Slowly bring your right hip high up. You will have your hip will be at a right angle, and your knee should be right angle. This foot has a right angle, this hip has a right angle. You are close your eyes. Breathing out longer than breathing in. If you are doing with me, try this. You will have a profound level of relaxation. More and more relaxation response you have, better and better will be your therapy for metabolic syndrome, because relaxation response activates parasympathetic tone, which counteracts the sympathetic tone of your stress. Turn your head to the left side. Again, take your left lower extremity, your hip joint on your thigh at the level of 90 degrees with your body, and your left knee also at a 90-degree angle. Close your eyes, breathing out longer than breathing in. More and more you are relaxed, better will be your proper elimination. Tirjak Bhujanga Asana. Oblique cobra pose. We generally put our feet together for a cobra pose, regular cobra pose. Regular cobra pose is your hand on the side, your feet together, and you slowly get your body high up and keep looking high up. And able to stay here. In a Tirjak Bhujanga Asana, you separate your feet until the width of your mat. Slowly get up into a cobra pose, then look over your left shoulder towards your right foot. You can see that it is causing a massage to your abdomen. Get slowly up in a cobra pose, then look over your right shoulder towards your left foot. And slowly come down. Tirjak Bhujanga Asana. Another good sign of health in yoga is that able to get up without a support. So you're sitting here, you will be able to get up without a support. And able to come down without a support. So, if you are going to do this Shankha Prakshalan, we have done it two asanas. One is your Malasan, sitting down, and then extension of Malasan was your Udar Karshan Asana, abdomen massaging asana. Then we did the Tirjak Bhujanga Asana, oblique cobra pose. Now, this is your sign of health, that you're able to sit down in a squatting pose and able to get up without any support. Sit, rise, test. And we do it throughout the whole day. Once you can do this, this is one. Second, I have shown you sign of health, able to stand on one foot with your eyes closed. Very interesting asana. But when you extend this, what you can do, you can go all the way down to the ground. You can sit down in the ground. You should do it with me. It's a fascinating experience. All the way down to the ground, and from here able to get up without a support. Try this. Very rewarding. Once you're able to do it, metabolic syndrome, any chronic disease is not going to come close to you. They will say, this is not the body I need to be in. Same way for the balance, you can do a opposite side, sit down, now cross your feet in the opposite side. If you use one hand, you lose 25% of your health. If you use two hands, you lose 50% of your health. If you lose two hands and 1 feet, you lose 75%. Always, always get up with your 2 feet. You don't need 4-wheel drive. You don't need 4-wheel. 2-wheel is good enough from here to get up without a support. When you get up, for your balance, we are comfortable standing like this. That's how we stand. See if you can stand with the feet together. Hold, or you can put a prayer pose to the back. Okay, Paschim Namaskar. Take your both the feet, both the hand, do a prayer pose to the back, and stand here. Then see if you can stand on one foot. Try standing on the non-dominant foot. I'm standing on my left foot. 10 seconds, 20 seconds, 40 seconds. Then I see if I can close my eyes and can stand on this foot. If you can stand with your eyes closed with one foot, especially non-dominant foot, that is a sign of your health. I have been doing it for a long time, but still I don't have any, I'm not have a proper balance. Human being, well, I'm not in a perfect health. Same way, I'm on the right foot. Close my eyes and see how long I can stay with my right foot with my eyes closed. Keep doing it. It is a wonderful experience. Sign of health. Able to get up without a support. And it showed a lot of studies, a lot of cardiological studies, it's shown that it is a powerful tool for your cardiovascular response. Wow, I have a one pillow here. I have 2 pillows, with a sunflower in it. What? Oh, very nice. I can put it here, or I can use it during my sleep. Utthita Tadasana, upward mountain pose. The Tadasana. Feet together, clasp, put your hand over your head, put your head here, slowly get into tippy toes and hands will go higher. Upward mountain pose. If you do an X-ray, if you do a barium mill X-ray, you'll see your whole intestine is getting cleaned with this, part of your Shankha Prakshala. Tirjak Tadasana. You can hold your one hand, put it over your head. That's the way you're not too much moving around, aggravating your vata. Breathe out first, deep breath in, slowly go to one side and try to stay this side with your eyes closed and breathing out longer than breathing in. Again, between 5 to 10 breaths. Tirjak Tadasana. Slowly come back. Go to the opposite side. What happened? Okay, I'm back. I'm sorry. I lost my picture here. Okay. So, how many asanas have done? 4. First one is your Udar Karsanasana, Tirjak Bhujangasana, oblique Cobra pose. Third, upward Utthita Tadasana, upward mountain pose. Then your Tirjak Tadasana, oblique mountain pose. And fifth one is a Kati Chakrasana. In a Kati Chakrasana, separate your feet. Kati means your west rotation. Put your hands in front. Breathe out first. Take a deep breath in. Breathing out, slowly put your hands all the way to the back. And same breathing cycle, slowly come back into the middle. Breathe in here. Breathe out. It is so powerful, relaxing asanas. This is called even a moving meditation. It is very powerful meditation for kapha people. Essentially, the meditative practice is close your eyes and pay attention to your breath. With the eyes closed, breathe out first. Take a deep breath in and slowly breathe out. And in the same breathing cycle, come back into the middle again. Continue this in the opposite side with your eyes closed, and you'll have a profound, a relaxing response in your body and mind. Keep doing it. It's a wonderful practice. In fact, we recommend this for the kapha people. The kapha people, if you put them on the mat for meditation, they will go to sleep. They need a moving meditation. You also can do this with your hands. The right hand goes to the back, left hand goes over your right shoulder. Breathe out first. Take a deep breath in. Slowly turn your body towards your right side. Another variation of your Kati Chakra Asana. You can try on both sides, see which side you will feel a little better. To the opposite, left hand to the back, right hand on your left shoulder. Breathe out first, take a deep breath in and slowly turn your body all the way to the back. Slowly come back to the middle. side. So I did a 5 asanas for the strong digestion, 5 asanas for the proper elimination, and the next one is your sleep. Very, very important. So for the sleep, sleep is not the time. Sleep is the deep sleep. During the deep sleep, your body does all the repair which you need. Your growth hormone gets higher, you name it. Everything is in order in deep sleep. Sleep is divided into 2 types of sleep. One is called a rapid eye movement sleep, called REM, and another is your non-rapid eye movement sleep, non-REM. Rapid eye movement sleep is about 25% of our sleep, and non-rapid eye movement about 75%. In rapid eye movement, REM sleep, our mind is still active. In non-REM sleep is the real sleep. It has 4 stages. First 2 stages are almost 50%, and next 2 stages are another 50%. So this 3rd and 4th stage of your non-REM sleep is your deep sleep. So if you get a health tracker, if you get an Apple Watch, or if you get a Fitbit, whatever you are going to use, you will see that they will give you this much amount of time you slept, but your deep sleep 2 hours, hour and a half. Very interesting. People come and says, I didn't even sleep more than an hour in the deep sleep. What's wrong with me? I said, this is exactly what you're talking about, the timing of the sleep. It is not 6 hours, it is not 8 hours. We know if you sleep longer, it is harmful for your body and mind. We need an optimal amount of sleep. And it varies from person to person, and we know if you get an adequate sleep. What is the sign of adequate sleep? No daytime sleepiness. If you're sleepy in the daytime, you didn't sleep enough last night. When you go to bed, you got a lag time. If you fall asleep in less than 10 minutes, you are sleep deprived. If you cannot sleep more than 30 minutes, you have an insomnia. So let's try getting into the bed. You really don't need a pillow, but if you have a one pillow, it is nice. And you sleep like a baby and also sleep like a yogi. Yogis sleep in a fetal position on the left side throughout the whole night. They start with the right side, the left side. And the baby sleep with a feet together. It is called your Supta Baddha Konasana. If you have not seen it, watch baby. Every baby will sleep. Baby will sleep like this. So I'm putting a little pillow, so because most of them you will need, which I really don't need, but I can use it to show it to you. A baby will put your one foot like this, another foot like this, and Then they use the hand called the Balo Mushti Mudra. They take the thumb inside and close. That's why baby closes their fist. Balo Mushti Mudra. The Balo Mushti Mudra, you're sleeping. Incorporate the breath like a baby. Baby does your abdominal breathing. Abdominal breathing is relaxing. In abdominal breathing, when you breathe out, abdominal wall goes in. When you breathe in, abdominal wall goes high up. Breathe out. Wall goes up. Breathe in. People always ask me, how long should I do it and what is my effort level? Effortlessly, if you can, you will fall asleep very quickly. Once you do abdominal breathing, then you do breathing out longer than breathing in. You'll do a 5-second in, 10-second out. That means count of 5 in, count of 10 out. If you cannot do that, do it the amount you can. 3 seconds in, 6 seconds out, even 2 seconds in, 4 seconds out. Try to do the exhalation longer than inhalation. We've been doing for a long time, so you can do it. Breathe out first. Count of 5 in. Count of 10 out. This is just a one cycle. You can continue this effortlessly. If you do 5, 10, you will see, you will fall asleep very. It may not happen in the 1 night, 2 nights, 3 nights, but if you keep doing it, it will happen. You will fall asleep right away. One more time, breathe out first. Count of 5 in. Count of 10 out. Then you incorporate the breath holding. In a breath holding, your carbon dioxide goes high up. You develop what is called a CO2 narcosis. Carbon dioxide is high up, it acts like a narcotic. Ratio is 1:4:2. We'll breathe in with a count of 4 in. We'll hold the breath for count of 16. Breathe out, count of 8. And we'll be doing it few cycles. I'm going to show you only 2 cycles to show you how to do it. Breathe out first. Breathe in with a count of 4 in. Hold your breath, count of 16. Breathe out with a count of 8 out. One more time, breathe out first. Breathe in with a count of 4 in. Hold your breath, count of 16. Breathe out with a count of 8 out. Do it few times, for a short time you'll fall asleep. First, you turn to your right side with a fetal position, like sleeping like a yogi. On your right side, in a fetal position, it's a balance. Sleeping on the right side, your left nostril opens up, which is cooling, which is your Chandra Nadi, moon energy. Your body core temperature still remains high. Breathing through the left nostril balances the high temperature in your body with a cooling left nostril breathing. For a whole night's sleep, you sleep on your left side. Yogis sleep on your left side. They really don't have any pillow. They generally put the hand and put the head in the hand. If you have a little pillow, you can put your hand in between your knees. Close your eyes. Do the breathing out, normal, then breathing in. Guaranteed you will fall asleep very quickly. When you are deep sleep, your body core temperature comes down, all the muscles start to relax very slowly. Right nostril breathing is heating. Suranari, sun energy, it balances the inner cooling of our body. Also, our main blood vessel called inferior vena cava, which is returning all the blood to the heart, is on your right side. It is a low flow system, and you sleep on your left side, it stays open, so venous return to the heart is very adequate. If you sleep on the right side, then it presses on the inferior vena cava because it's a low pressure system, and the venous return to the heart, which is called a preload, which gets reduced. The most effective cardiovascular function is increase in the preload and reduction in the afterload. Afterload basically is a relaxation of your blood vessels, reduction of the peripheral resistance. You'll be sleeping like this. You will have enough deep sleep. When you need to wake up, you straighten up your right foot, slowly put your hand on the side and get up and sit down. Follow the rule of 90 seconds. We discussed about it. Sit down for about 30 seconds for all of your body physiology gets together, and then stand up for another 30 seconds, and then slowly move for another 30 seconds. So 90 seconds, follow the rule for 90 seconds, and you will be in a perfect health and maintaining a perfect day balance. Summarize: restoring health, Shastarokha, strong digestion. Signs of strong digestion is lightness on your body and mind, appropriate hunger and thirst, no smell in your excreta, urine, stool or perspiration. and proper natural urges. Proper elimination first thing in the morning after Ushapan in a squatting pose or using a squatty potty. Proper sleep, sleep like a baby, sleep like a yogi, and it's a deep sleep which matters. It doesn't matter how long did you sleep. Turning, tossing on both sides without having a deep sleep. And that's what you say, always use a health tracker. Apple Watch is good, Fitbit is good, there's a plenty of health tracker, and all the health tracker this time comes with your sleep analysis. Okay, I think we have talked enough about metabolic syndrome because we wanted to really emphasize on you that this is the number one killer, and then we'll go a little bit more in details with all our disease specific yoga therapies. Remember, yoga therapy is still a holistic. It is not a reductionist like a Western medicine. But also at the end of the day, we said yoga therapy is also called a reductionist holism. Reductionist holistic. Okay, thank you again. See, if I'm in town, I don't miss it. My daughter lived just half an hour from my home. We had to come here to take care of our grandbaby and did the class from here. So hopefully I'll see you again in the next Saturday. If I'm in town, I'll be here. Any questions, comments, please post it on the Facebook. And when I go there, I'll answer those.